I remember very clearly the first day it began. I was 13 years old, and I was at a debate camp at Cal State Fullerton. In the middle of my speech, I felt a very sharp pain in my stomach that went all the way up to my chest. The pain was so bad that I had to go home.
What are you asking?
I'm saying, how are you feeling?
Not good.
What's happening?
Chest pain. I had no idea that that day would mark the start of my journey with chronic pain, one that's lasted over 3 years so far. A journey into hospitals, physician consults, supplements, drugs, infusions, every treatment you can imagine to figure out why I continue to feel pain all over my body. It's also been a journey into realizing that I'm not alone.
I'm not just missing school because I have a little headache, like I actually can't be here. It's like not healthy for me to be here.
Every person with chronic pain that I've talked to has dealt with doctors thinking it's not real.
Through everything I have learned, one thing became clear. Our conventional beliefs about chronic pain are wrong, and dangerously so. It's time we change that.
No, I don't remember like a day. I sort of don't remember a general time. It sort of like happened very slowly in like middle school and then got really bad when I started high school.
I was 6 years old, pitching in a Little League baseball game, and I threw the pitch in. The batter hit the ball back straight into my xiphoid process. From then on, I had that pain.
The next week after I experienced symptoms, I visited every doctor possible, ranging from naturopaths to endocrinologists. Even though the pain started in my stomach and chest, it soon happened all over my body and ranged from sharp aches to dull aches to burning and tingling sensations.
I started off just thinking like I had headaches a lot. It gradually got really bad, and I think like I had my first migraine maybe in like 8th grade.
I kind of just described it generally as a stomach pain. We went through a lot of different doctors looking at basically anything we could find. This continued until I was about 12.
I was eventually diagnosed with Guillain-Barré syndrome, an autoimmune condition where your immune system attacks your nervous system. And while I was able to get over the initial symptoms of Guillain-Barré syndrome, I soon developed small fiber neuropathy.
I found a pair of doctors. They diagnosed me with chronic pain.
I think it like starts off as like a headache, and I feel sort of nauseous and like generally weak, and it gradually gets worse and worse. I think usually at the end of the day, like I get really bad like searing pain above my left eye. It feels like, I guess, like a stabbing pain, and usually I'm like throwing up because it hurts so bad.
For the first year out of the hospital, I had severe brain fog. I even felt like I was going insane because I had the sensation that my skin was wet when it wasn't, or that bugs were crawling on me when they weren't. Simple tasks like walking up the stairs or taking a shower were too painful, and I couldn't sleep because I had severe chest and back pain.
I sometimes get like pain throughout my body because of it. And like generally like I can't be in the light, like no noise, no moving around. And like usually it lasts like 36 hours.
I've that pain that comes back in all my various spots, and I get really fatigued. That's a big part of it for me. Those are the two big things, the pain and the fatigue. I'll also get brain fog and just some general body aches.
3 years later, I still find it hard to describe the pain I'm feeling. Sometimes I'll be sitting in class and I'll feel like the wind has been knocked out of me. Or I'll be walking up the stairs and I feel a very sharp and pounding pain in my legs and head, and it'll take an hour to go away.
I just have a headache for a week. I've had headaches for like a straight headache for like 2 weeks, I think. And it never gets really bad, but it's sort of consistent.
The nature of my pain is so variable that there is no typical pain day. Now when I get pain flares, it's mostly in my back, so sometimes it'll be my lower back and shoot down my legs, it'll be my upper back and go down my arms, or it'll be in my neck. When I was first diagnosed with this condition, I used to have whole body pain flares that would last for weeks on end.
It's not just adults who suffer with chronic pain. 1 in 4 children are victims as well.
About 100 million, or 1 in 3 Americans, live with chronic pain.
Since millions of Americans cope with chronic pain every single day.
That number is more than people who live with heart disease, diabetes, and cancers combined.
Chronic pain is clearly a massive problem, but what exactly is chronic pain? And how is it different from the pain you feel when you stub your toe or burn your finger?
You'll say, I have chronic pain, and the first place someone jumps to is comparing pain that they've had to their chronic pain, which I think is a pretty logical step. You're trying to connect and understand, but it's just not really comparable in that way, because chronic pain is its whole own thing.
Acute pain is from some injury or surgery or an infection. Pain is our warning signal to take action. For some people, the pain continues and transitions into chronic pain.
Because when somebody has been in pain for a really long time, especially for a child, a really long time doesn't have to be that long of a time. What happens is that almost literally at a neurological level, you develop feedback loops of pain in the brain, where the brain starts to anticipate, almost bracing for the next time the pain is going to be there. The loop is a sense of hopelessness and helplessness and pain.
Why is it so hard to diagnose chronic pain? The biomedical model says you hear the symptoms, so you hear the history, you do an exam, a physical exam. If you're smart, you do targeted testing, and then you wait for all the results to come back to find the cause of the pain. But what happens with ongoing chronic pain, however it started, over time it picks up more baggage. So there's never a cause of the pain. The exam, other than finding areas that are painful, may be negative. You don't hear anything in the heart, you don't see any red swollen joints, you don't see an infection, and the tests come back negative. So the assumption by most doctors using this biomedical, very old model is that, oh, it must be stress, whatever that means, or it's psychological.
I was diagnosed with, I think, every possible diagnosis. I'd be conflicted because they tested for this horrible thing that could have been bad news. And turns out I don't have it, which is great, but I still don't know what's wrong.
This means that the diagnosis process for chronic pain patients is often lengthy and frustrating.
Finding out what caused it hasn't happened yet. We don't know what causes them.
And I remember being probably 8 or 9. We'd go into the next doctor and I'd just zone out because my parents were going to tell the same story and they were going to have the same questions, and it felt like it wasn't going to amount to anything.
The diagnosis process is made even harder because as kids, we often don't know the right terminology or even the right words to describe our pain.
I had trouble describing my own chronic pain now, and then back when I'm 6, 7, 8, 9, I don't think I was even close to as concise as I was right there.
I remember struggling to describe my pain initially when doctors asked me what it felt like, because all the adjectives they were giving me didn't really fit. Like they said, is it like knives stabbing you? Is it dull aches? And I really just didn't feel like anything was the right way to describe it. And it wasn't after I learned the nature of my condition where I realized it did feel like nerves were misfiring in the body and that there was something broken. Combine the difficulty in diagnosing chronic pain with patients who don't really know how to describe it, and you get kids not really being believed.
Something, as I've talked to kids with chronic pain, is that being believed and accused of faking and being told it's in their head is common in so far every single case that I've heard about.
Yes, probably almost every one of the kids who comes to see any of us on the team or anyone with chronic pain has had that experience. Usually the kids have up to 20, 30 doctors they've seen, and they've been told it's all in your head, or the doctors have thrown their hands up. Sometimes doctors have just gotten frustrated with the child. It's getting a little better, but I think most doctors just aren't trained to understand how acute illness and injury can then become chronic pain.
The complexities that exist in the world of chronic pain don't end with the diagnosis process. Our struggles extend into school and trying to find the right treatment.
Yeah, I mean, like, one thing that I've also encountered is like getting in trouble for having medicine on me.
Schools really need to understand it is just as legitimate for a child to have accommodations for chronic pain as they do accommodations for a child with a seizure disorder or diabetes or a broken leg in a cast.
Schools have a hard time believing children when they say they're in pain. If they have an injury and that's causing pain, schools don't do a bad job overall, because when kids are experiencing pain, they go to the nurse's office, they have access to calling parents for support. There's things that they can do when there's a known organic or structural reason for the pain. But when children have functional pain, where they can't identify what has caused it, then they tend to blame the child.
It's really hard for schools because when kids show up one day and seem totally fine, and then the next day they miss, and then 2 days later they show up and they seem totally fine again, then the school feels like they're making it up.
And they're lazy, and they're just avoidant, and they're trying to get out of stuff. And why is it that the only time you are in pain is when there's something that's upsetting to you that you don't want to do, and then conveniently you're in a lot of pain and the child isn't believed? There are children that do that sometimes to get out of things, but for the most part, children don't do that.
What I run into with the schools the most in terms of problems is that they often say that the child has to either be completely unenrolled and on homeschooling, like home hospital, or they're there full time. If you take the kid out of school, you're removing their socialization, you're making them completely isolated, and you're reinforcing their sick role. So I don't like them to be out of school completely. And if you're expecting them to be there completely 100% of the time, that's not realistic either.
Yeah, I mean, they tried to take me to the hospital at debate camp.
Really?
I was like, no, it's fine. Like, I know, like, you just need to let me, like, go into my room and, like, bring me some Gatorade or something. And they were like, no, if you're sick, we need to take you to the hospital. Like, otherwise you can go to class. Like, hospital or class. And I was like, So I went to class, and then it got worse.
So these are all the supplements and pills I've taken. This is like the gabapentin. I felt really drowsy on it and really tired, and I couldn't really focus on school or anything. Amitriptyline I also tried. This one tastes really bad. And then these are very big, so they're hard to take. This is the rhodiola. This is CBD. While I do get like some brain fog with it, I actually feel really a lot better on it. My family has learned a couple things over the last 3 years. First, there is no magical cure to chronic pain. There are many pharmaceutical options other than opioids, antidepressants, anti-inflammatories, anticonvulsants. Many of these are being used off-label with varying results.
Not only in children, but also in adults, there is a varying reaction to these different medications. What we're learning about pain is it affects a lot of different pathways and a lot of different aspects of your brain. So the gabapentin might not be appropriately affecting the areas that are truly affecting some of my patients in their pain.
Second, there are many non-pharmaceutical options that have been shown to be effective in treating chronic pain. Pulse electromagnetic field therapy, photobiomodulation, neurofeedback, biofeedback, acupuncture. Third, for any of these therapies to work, they must be integrated in a cohesive interdisciplinary framework known as the biopsychosocial model of treating chronic pain.
So basically we're looking at the bio part is, what's physiologically happening inside. Then the psycho part is, we talked about anxiety or depression or OCD or other stressors that are exacerbating or prolonging the pain process. And then the social part is, how is the kid interacting with their family, with their friends, with their school, with their after school activities, and what's happening in the greater world. So when I'm treating a child, I'm sort of like a detective trying to figure out which of the factors are influencing the pain, which of the factors are prolonging it or making it worse. And then once I sort of figure that out, then we figure out, okay, what's the best way to stop that cycle between the mind and the body.
So this is the photobiomodulation device I use. I use it mostly when my pain flares up. Are there examples you have of somebody who had chronic pain that was not resolvable, and then your technology has helped them?
Oh, so many. Yes, it's endless. Over 700 randomized placebo-controlled clinical trials. Various forms of neuropathic pain like shingles and post-depressive neuralgia, musculoskeletal pain, so sprains and strains in creaky joint, shoulder pain, tendinopathies, osteoarthritis. Using that point locator you just described, just treating neck pain with that gives people instant relief from something they've suffered with for decades.
This is a pulsed electromagnetic frequency device. I've used a lot of pulsed electromagnetic frequency devices. I've used like MATs, and then I've also used these. These are OSCAs.
PIMP itself has been around for many decades, used with wound healing, long bone stimulators. If you break your femur, there's a good chance that your orthopedic surgeon will get you one to help regrow that bone faster. So the technology's been around for a while. What we've done is honed in on a few frequencies that we've seen to be most effective for pain and healing, vascular improvement. So it uses a cycle of those frequencies in a really portable, easy to use way that you can just carry around and turn on and use it for a couple hours.
Chronic pain in my clinic, I use what's called neurofeedback. I start off using the quantitative electroencephalograph, which is brain mapping technique, which looks at how is the brain functioning, how are the neurons communicating with each other, what do the brain waves look like within the brain. So once we have the brain mapping established, we then determine what are the particular areas of the brain that we need to focus on. Chronic pain generally has a certain profile, and then once that is established via the brain mapping, then we do the neurofeedback treatment.
Acupuncture is well known as an ancient Chinese healthcare practice. Less well known is that over the last 30 years, peer-reviewed scientific studies have shown it to be effective in treating back and neck pain, sciatica, chemotherapy-induced nausea, gastric conditions, sprains, reducing risk of stroke, headaches, and chronic pain.
And especially chronic pain is a dysregulation of the nerve signaling throughout the sensory system in the body. Craniosacral therapy helps to locate restrictions, improper pressure, any sorts of compressions or adhesions within the craniosacral system that might be impacting the nerves, facilitating an ongoing perpetuation of those pain signals.
Seems like I'm laying out a kind of ambitious idea for our medical system, one that can integrate all these different treatment modalities and treat all these kinds of patients. But the funny thing is, we once did that. Meet Dr. John Bonica, wrestler, soldier, circus performer, as well as world-renowned anesthesiologist. If you didn't know who he was, don't worry. Neither did I. Back in 1984, Time magazine formally gave Dr. Bonica the label of Pain Relief's founding father. Over 60 years ago, Dr. John Bonica realized that the best way to treat pain patients was to integrate multiple different treatment modalities with a special emphasis on psychological and social interventions. Studies proved him right.
Looking at all of the programs that include psych within pediatric offices or clinics, and the outcome turned out to involve less pediatric time, cost savings for insurance, and faster treatment and appropriate treatment with fewer tests needed for the patients?
The difference between just a pediatric health clinic and a pediatric pain clinic is that there's a focus on more of the mind and the brain at pain clinics. Most of what is looked at in the medical world is the plumbing of the house, just the physical part of it, while some of the pain comes from the wiring, the electrical part of the house, which would be the mind and the brain. And pediatric pain clinics focus more on the electricity than the plumbing.
But today, it's hard to find a truly interdisciplinary pain clinic in an average American community, because our healthcare insurance model has undermined the financial viability of pain clinics. The key major barrier to the wider authorization and use of interdisciplinary pain management programs has been these insurance payers, even though study after study shows that the biopsychosocial model saves money in the long run.
If more medical insurance covered more psychological intervention in pediatricians' offices, or so that they work together, there would be far lower cost for healthcare. We know, and I did a lot of studies with my team on yoga and mindfulness and acupuncture, art therapy, music therapy, biofeedback. There are a lot of non-drug interventions that we know can have a physical effect on the body. But our healthcare industry has separated kind of medical and psych.
Chronic pain is a difficult mystery, but it's possible to find a path through it. That path, while it may not mean a complete cure, it can mean finding your own sense of peace with chronic pain, no matter how long that takes.
In conjunction with all the new medicine I'm trying, and I finally got into the doctors that I wanted to see a few weeks ago, and it sort of feels like I'm having a good spell, which is great.
I think that I'm going in a really positive direction. I've gotten to where I can decrease and occasionally just get rid of my pain through different meditations and visualization.
As for me, chronic pain has given me a purpose. It has driven me to understand how chronic pain works, to research different treatments, and to understand how those treatment modalities can be made accessible to everyone. Chronic pain has also taught me to appreciate the love and support I get from my family and friends, and the smaller moments in life.
Big and small is not the right way to look at time. Maybe it's not about big moments and small moments. Maybe it's about any moment where we give or receive kindness, respect, friendship, generosity, love. Any moment where you think of others. Any moment when someone instinctively cares for you. Any moment that you're not in pain.
While I'm not pain-free, I have been able to reduce the frequency of my pain and to calm my nerves when there is a flare-up. Most importantly, I have learned to not be intimidated by the ambiguous, invisible, difficult to diagnose, difficult to treat, and difficult to explain nature of chronic pain. The more light I've shined on it, the less invisible it became, and I was able to manage it. Hopefully, if you're a chronic pain sufferer or you know anyone with chronic pain, you will do the same.